Welcome. Thank you for having me. I was a teenager when I met my teacher, and I was looking for something. It was the 60s, and wild, adventurous hippies were doing things, and I thought some of that might be interesting. What's that? All right. So there we go. Anyway, it was the time of wild, adventurous hippies. I met my teacher, Yogi Bhajan, and he said, what took you so long? I said, what are you talking about? And he said, I expected you before this a little bit, but here you are now, so we can proceed. Of course, I had no idea what he was talking about, but then you know, soon thereafter, he said, you'd make a good Ayurvedic practitioner and herbalist. You want to study with me? And I said, okay, having no idea what that meant. And, you know, 32 years later, then, finally he passed, and I've been carrying on the torch for the last 15 years. Ayurveda is going through a tremendous renaissance in the United States. The fact that we could have this kind of a conference is really true. And this shows us that Ayurvedic miracles really do happen because we're actually on time, and Shanti Shantikar cut short her presentation so that we could stay on time. Truly a miracle. So I'll return the favor. All right, so we're here to talk about neurological disorders and Ayurveda. I'll throw in a little Sikh perspective since we're talking about that also. In 1980, I started the first multidisciplinary holistic healing center in Seattle, Washington. Sounded like a good idea. It turned out it was probably an idea whose time had not yet come, but the idea was to put a bunch of holistic practitioners together. So, as is our custom, we go to our scriptures and open up the scripture and read a random verse to sort of bless what was going on. So we were at our new clinic, and we opened it up, and this was the scripture that we saw, which of course refers to Vata Pitta Kapha from the Ayurvedic perspective. So all the verses in this huge book, this is the one that came up when we were opening up a new holistic healing center. So I took that as a pretty good sign. Dr. Narenkar mentioned earlier this saying from Yogi Bhajan, but Sikh Dharma is a religion, let's not even call it a religion, a dharma, a lifestyle for householders. And so we have families and checking accounts and drive cars and take our cars for oil changes and do all those things that anybody would have to do. And our idea is to keep the sanctity of every moment involved in that process and to understand the holiness and the worship of every single thing. Guru Nanak very succinctly said that work is worship, and so we keep that in mind every day. You don't have to go to the yoga mat or your meditation room to have some special experience. You can live it every day that you're living it. This is another scripture from our tradition. And the idea here is not to exalt pain. Nobody wants to do that. But the point is to remember that pain and pleasure all come from the same source. It's just our perspective. And so we're open to whatever God gives us, whatever the universe gives us, and our mission is to stay connected to that divinity at all times. Similarly, another phrase from our tradition, every limb is God. Just means that every single fiber of our being comes from God. We're going to go to God. We're temporary custodians of this body. But while we're here, it's nice to not be constipated, wouldn't you all say? So we'll talk about that, and then we'll talk about not being constipated in your mind also, which is also pretty important. So our question would be, what is not Dharma? When people ask me, what is Sikh Dharma, I have a hard time answering because I can't come up with anything that's not, because every single thought, movement, you're eating beans, you're going to the toilet, you're having a baby, you're going to your job, you're on the freeway in the rush hour, it's all Dharma. So that's our idea every second. Well, that brings the same question about Ayurveda. When people ask me to explain Ayurveda, I also kind of have a hard time because what isn't Ayurveda? When you're having brain surgery in a hospital, you're undergoing an Ayurvedic procedure in some sense. Everything is about Ayurveda. So we can have an Ayurvedic perspective on anything. Ayurveda just means the science of life, and it comes from an ancient tradition, but it's not static. It continues to develop today, and we're understanding how to incorporate, let's say, North American herbs into an Ayurvedic perspective as well. It's continually evolving and improving. That really there are three Ayurvedas that we talk about when we ask these questions. One is the traditional Ayurveda from the sources, from the scriptures. And we have an idea how those people function, but we don't really know. All we can do is read the books that they wrote and assume that they were doing a good job and things were going well. Then there's the Ayurveda that's currently being practiced in India, which is not monolithic by any means. You know, one of the funniest things that people say in our field is Ayurveda says, but of course then you could say, well, which Ayurveda, what Ayurveda, according to who, from what book? There are thousands of opinions, legacies, schools, traditions, histories, and people of goodwill can disagree. Even today, I'm sure some speakers have said something that you didn't like or somebody next to you didn't like, and it's all part of the process of learning. We want to understand the basis of why people have these ideas, and then there's the current practice of Ayurveda outside of India, including us, which is just a nascent entity that's just barely been birthed. I've been involved for almost 50 years in this, in this process, and we're just really sort of starting to get going. When I first began studying, I had to learn about herbs that I couldn't see because we couldn't get them from, from India, and now you can, with one click of your mouse, you can have it there tomorrow. So. Beautiful. Things are really changing. So we're talking today about neurology, and if you asked me 10 years ago if we could successfully use natural healing or Ayurvedic methods to treat something like MS, I would have said, maybe yes, maybe no. Now I'm very confident. This is my specialty, and I wade in the waters of migraine, epilepsy, autism, dementia, MS on a very just every day on a daily basis, and just tremendous kinds of results. Are we doing it the same way that they did it in India 2,000 years ago? Probably not, but we're using those processes and our newer methods and resources to be able to treat it effectively today. So we think of the whole world as Ayurveda, and of course we work with prana. It's all based on that whole idea here. We touch people with compassion, we work with them with energy. And whatever herb we give them, the bottom line is that we want to help them heal according to their own being's journey through their spiritual process. Uses vibration, the Shabad. We talk a lot about sound in my tradition, and you just experienced some of that. So we get the chance to work with that vibration, and that's really fundamentally what we're working with. Ayurveda can be practiced in a very, let's call it, allopathic sense, that you use herb X for disease X, and that's increasingly common these days, but that's not the true essence of the science. We work with energy, we adjust energy to get the outcome. Dr. Shanti said that treat the person that has the disease, not the disease that has the person, and that's exactly what we do. Ayurveda in the scriptures is a little vague about these neurological conditions. The energetics involved are very straightforward, but the names are a little confusing, and it's kind of a big bag of stuff, often just kind of called vaguely insanity or something like that. But the specific kinds of things we can do for people we know very well now. We use all these things that connect us to this universal vibration. Mainly I'm going to talk about herbs today, and let me assure you that everything that's on this screen I can get to you. So there will be some technical information in a moment. No need to scribble it all down. If you want to take notes for yourself, that's great, but otherwise I will make this available to you. I have a colleague somewhere passing out lists. If you give me your name and your email, I will mail you the link to get this PowerPoint set of slides and a bunch of other handouts for you that go into much greater detail. So a little taste of Ayurvedic neurology today. Herbal medicine today is very, very effective. We've been evolving it since the new renaissance in the United States in the last 50 years. It's dramatic, it's effective, but we have to do it the right way. So the key issues here are first the right herb, which is of course challenging, the right quality, again challenging in our environment, and then the right dose. Dose is very much an issue, and from the Ayurvedic perspective, most American herbalists used very, very small doses. When I first studied with my teacher, people were horrified at the doses that he was giving, but they were just the doses out of the scriptures, and that was at a time when herbalism was absolutely nothing. It didn't exist at all in the United States, and people were scared and bothered by it, but that way of doing things became known as a way to, if you're really serious about it, you would experiment it. Ayurveda, along with Chinese medicine, uses what we would call pharmacological doses, or large doses to produce very specific, observable, noticeable effects in the body, often for long periods of time, but we formulate in a way to offset those things. So if an herb is a little too hot, we use a cold herb with it, something like that. Here's an example from the point of view of tea. Dr. Kumar, one of our colleagues here, was just saying that the standard dose is about 60 grams of a crude herb, and then the experience has shown practitioners in India and here that that Indian dose is too high for good compliance. Western folks living in the United States, Europe, aren't used to taking those kinds of doses, so they cut the dose down by half or a quarter or 90%. And of course that reduces the results by half or a quarter or 90%. So we have to pick the right herb, the right quantity with the right dose. If we take a look at this Ayurvedic scripture, we just read here. We don't need to go on to the details here, but it translates as one dose being 48 grams of raw herb. That's about 7 tablespoons of raw herb powder for most people. Ayurvedic herbs are typically administered in mixed powders. They always taste horrible. Every one tastes worse than the last. In fact, there's a contest every year in India to see who can concoct the worst tasting Ayurvedic formula. Not really, but it sure seems like there must be, because every one is horrible. They all taste like, if you ground up an old barn door and ate it, it would taste better than most Ayurvedic concoctions. But they're there to do the job. You're only going to be swallowing it for a few seconds, then you're done with it and you can move on, with your day. This same text also talked about these doses of powders. And we see here a typical dose would be about 12 grams. Well, many Western doses, American doses, are somewhere in the neighborhood of half a gram or a gram for many things. So many herbs have been underdosed for a long time. People often have the experience of just not taking enough and not getting any results. Let's talk about a few of these. Now, there's a lot we could say about each one of these, so really I'm just introducing you to these, and then if you want to give me your email, I'll send you this link, and then you can have a lot more material. So ashwagandha, an herb that is in the top 2 for sales in the United States this year, a big interest in ashwagandha. And you've probably all heard of it. Ashwagandha is an herb that's very often in many Ayurvedic formulas for the brain. It's a grounding herb. For those of you that know this terminology, it's an anti-vata herb, suppresses vata, stabilizes the nervous system. So some of these herbs will have a bunch of this detail. I'm not going to go into that. But again, you can get that from I'll send it to you. So 12 grams of ashwagandha would be a dose for an acute situation, and maybe 1 to 2 grams if you were taking it over an extended period for your lifetime, ashwagandha root. So very much mind and brain formulas. We find it in almost every formula for the brain. Grounding, as I said. All right, so the dose tends to be higher than people often think that it should be. Geta Kola is one of my favorite herbs. This herb really delivers, and again, it's a dose concern. You have to get good quality and good dose, and again, you can email me if you're interested in some sources for good quality kinds of things. But a nerve tonic for cognitive functioning and for nerve tissue support. This is my pillar herb for multiple sclerosis. I treat multiple sclerosis every week. I'm probably one of the leading natural practitioners to treat multiple sclerosis. I just saw someone who I hadn't seen for 35 years. Saw her 35 years ago to treat multiple sclerosis, and she became asymptomatic, and then I lost her to care, and she came back 35 years later, just a week ago, and said, well, I've retired now. I just wanted to check in, and no symptoms in the meantime. She'd been doing the kinds of things we talked about with no check-in for 35 years, but it worked very, very well. So it's a cold bitter herb, which is kind of unusual for herbs that we expect to build and replenish tissue. It's a special herb in that way. So it treats nerve diseases like MS or crushing injuries to the nerve injuries, that kind of thing, dementia, cognition in general. We're probably here going to use it mainly as a tea. In India, it's available in many different preparations, but here, probably a tea is the way to go. Every herb store would have it. It's very, very common. But I can't tell you how effective this herb is. Just really delivers for all these kinds of things. 30 to 90 grams a day as tea would be a typical kind of dose. So if you look in many American herb books, the dose will be 1 gram, and here I'm saying 90 grams, but that's for a very serious kind of situation. If you're looking to prevent dementia or work on your nervous system in some way, maybe even 1 gram a day consistently over time would be good. This herb is edible. We're not going to get it fresh here, probably. It's a tropical herb that grows in hot, moist places, but you could cook it into things like sag, pureed vegetables. You could rehydrate the dried herb and then cook that into that. I'll send you a recipe for Geta Kola sag if you're interested. Pureed herb with spices. So you probably all had sag at the Indian restaurant, pureed spinach or mustard greens, something like that, and just you can use Geta Kola as part of that process. All right, here's another recipe as well. So that will be in these materials if you're consented to you. All right, so ashwagandha and Geta Kola are very safe herbs that pretty much anybody could use anytime under any circumstances, and you should feel free to experiment with them. They're both very food-like. Ashwagandha is basically the root of a tomato plant, and Geta Kola is closely related to parsley, so no big deal. This herb, however, is a little bit more, you have to be a little more careful with. So this is an herb that is dramatically effective. We'll use the root of this calamus herb. It's going to look like this when you see it. A bunch of the details here, but communication, self-expression. It's associated with the fifth chakra. It helps your brain connect with what your mouth is trying to say. It's very well known for helping people who are having difficulty connecting their thoughts with their mind somehow. We don't really know very well how that works, but it's very, very consistent. So nonverbal people of one kind or another. It's the secret to me to helping non-autistic kids nonverbal autistic kids speak. I've seen that many times. We bring them to a certain level with whatever. We start with the calamus. A month later, they're talking. You can't shut them up. Imagine you haven't talked for 12 years, and now you're able to connect your brain to your mouth. So beautiful. Anyway, I've seen that many, many times. But that helps you. Maybe you're a singer. Maybe you're a public speaker. Maybe you just want to express yourself, that connection between your brain and your mouth. It's a swampy herb. So we dig it up, dry out the roots, use the roots. The word in Ayurveda is vacha, which means speech. So literally it has this long history of encouraging speech. So the nonverbal autistic children, as I mentioned, but even things like stuttering, self-expression, in general. Here we are in the Amarkantak forest, which is like a big national park, basically, in central plain of India, and this is growing wild there. So the issue with vacha is that it's exquisitely nauseating. Did everyone hear me? Exquisitely nauseating. The dose here says 1 to 4 grams. Do not, tomorrow with your lunch, take 4 grams, or you'll know why I said it was exquisitely nauseating. I usually start with about 250 milligrams, and then you can work up from there. And most people, if they work up slowly, take divided doses with food, can take 4 grams, which for most people is a pretty good therapeutic dose. But stop if you have any kind of queasiness happening, and then just sustain at that amount. All right, hibiscus flower. Ayurvedic herbs are very well known for having connections with your body, your mind, and your spirit. And every single herbal medicine has some kind of connection with those 3 aspects of your being. And they all have esoteric names and do great things for all those 3 areas. Here's one that is a relatively mild, kind of basic pedestrian herb for your body. It does some nice things, and we've seen a lot of nice science on this herb just in the last couple of years, but I just wanted to give you this perspective on hibiscus. We know it as a kind of a beautiful sour tea that we enjoy drinking, but look at all these great things that we did. We just did japa. So hibiscus is a way to help you do that. That's actually the name of the plant from the Ayurvedic perspective. So destroying life obstacles, spiritual and material, etc. So aiding in meditation. Some more details, you can get those later here. But spiritual obstacles, mental and spiritual power. So even if you have no need for it physically, you can use it for those kinds of purposes. What we're seeing in the science recently is cardiovascular support. So enhancing, lowering blood pressure, lowering blood fats, enhancing the cardiovascular function all the way around. It also regulates menstruation, so it's nice in that way, kind of a very general, broad-spectrum menstrual regulator. It's a mild herb. The doses are high. It's very, very safe. It's an anti-inflammatory, as you would expect from its color and its constituents. So you're going to make super tea, or you're going to make tea, as we know, but you could also use this in food. The dried hibiscus flowers are going to look something like this, and then you could cook those into anything that the taste was complementary. So here's a recipe for hibiscus soup. Nothing that fancy, a little bit of spices with some water, but you could give it a try. And again, I'll send this to you if you'd like, and then the usual tea. Let's talk for a moment about valerian, an herb that is very widely known. You've probably heard of it. There are 3 valerians that are commonly available to us. The first is European, this one, the Valeriana officinalis. And this is an herb that just knocks you flat. It's used for sleep. You take it, you're out. That's it. But many people have, it's a warming herb, and many people have uncomfortable reactions to this herb, and it tends to produce a hangover in the morning. So it's got some problems. For most people, it's not a great choice. Tagar, on the other hand, is an Indian species of valerian, Valeriana willickii, and that is much more tolerable for many people. Now, it's not a sledgehammer that just pounds you into sleep like the European. So if you need that, it may not be the herb for you, but otherwise it's less likely to create side effects. And it's used actually for mental clarity, whereas the European valerian is mentally dulling. This one is used with Matcha, that one we talked about, that enhances speech for mental clarity. It's used therapeutically, so it does not dull the mind when you take it. Jetamunsi is the 3rd type of valerian. Jetamunsi means the dreadlocked herb for the mind. You can see the herb itself wears dreadlocks like a sadhu's jeta. Jetamunsi, mun for the mind. These are the details here, but it heals brain tissue. It's combined with numerous other kinds of things. And again, this is even less likely to be able to slam you into sleep. So you have a spectrum of 3 possibilities to try with people, and try one and see how it goes, and then kind of go one way or the other depending on the temperature and the speed of action and how the dose and all those kinds of issues. Jetamunsi grows way up in the alpine meadows. Here we are up above Gangotri with digging up fresh Jetamunsi. So it's used to treat Parkinsonism, numerous other neurological kinds of things as well. That's the Ganga down there. Little valerian, a plant. So here we have this chart, and it shows us that European valerian is hot and heavy, Tagar is hot yet light, less sleep-inducing, more healing, and Jetamunsi is cool and light, tridoshic, if you know that terminology. It grows high altitudes, and it's a tonic for the brain. All of them will ease you into sleep, but we match the energetics of the herb to the person. Rauwolfia, very famous herb in Ayurvedic herbalism, very potent herb, and this is one probably you should use with some care. So of the herbs we talked about, the calamus is, you should get some professional advice about that. Calamus is not going to be that available, although you could find it in the Western herb market. Rauwolfia also not that available, but still you could buy it right on Amazon, so it is available to a certain extent. This one also probably needs some professional guidance because it's a very powerful herb. This was the source of the first extracted blood pressure medicine in the world. So removed from that, Reserpine was the name of the drug. We no longer use that drug here because it has some side effects. It is used in other parts of the world. Sarpaganda is the name of the herb. The root itself, the whole root, does not have the side effects, and so this is a calmative that works very, very well. It lowers blood pressure, of course, so we have to be a little careful. So since I work a lot with autism, this is an herb that very often helps autistic folks. Number 1, sleep. Number 1, be kind of calm during the day. Many people with autism have anxiety. This helps with their day-to-day anxiety. And as long as we're careful with their blood pressure, we can use a gram or 2 every day to kind of just, slow things down, and they discover they can kind of, connect with the things around them. And your average person can just use it for sleep. And of course, we need blood pressure remedies today. So very sedating hypertension herb. This is an herb that's way far on the spectrum of, if Geta Kola is like a parsley, like a spinach kind of food, this one is on the other end of the spectrum as being much more like a drug. There's no reason to take Rauwolfia as food. It's used as a natural drug, we could call it. So the source of Reserpine initially, 1 to 2 grams of powder. So you start with a very small amount, like 100 milligrams, start with that at bedtime, work your way up, see how it goes. And you could take it during the day if it wasn't overly sedating, and you could use it for blood pressure if you chose to do it. Again, probably better, even though it's easily available on Amazon, probably better to get some advice from a professional. However, I will send you some more information about that if I have your information. There are some of my flyers out on the table outside if you want to make contact later. However, you could easily just Google my name. It would get you right to my website, and then you could just email me from there if you want to do that. All right. Thank you all very much for your time.
Wonderful. Thank you so much for all of that information. And we actually have, and for keeping to the time, because we actually have a few minutes for questions. If anybody, before we go to break, we're about to go to break, would you both please come up here in case people have questions? I see a question in the back. So Shanti and Karta Purkh Singh, please come up. And then we will have a nice break. And we'll have 2 more sessions then before dinner. Okay. Okay, so there's one question up here and then yes, please. Yes. Maybe project a little more, yeah.
Who has a question?
I was wondering, how do you recommend getting this high dosage herbs for kids? Did you hear that? Let me repeat that. Yeah, so like with the higher doses of herbs, how are you delivering them for kids? Because they can't swallow the capsules, and it becomes so much for a tea.
You're asking how we get herbs into kids.
Yes.
Yeah. Well, depending on the taste, you can cook it into their food in some way or stir it into their food. You could stir it into something sticky like ghee or honey. There are certain syrups available, things like that. Traditional Ayurvedic preparations have a whole bunch of things, medicated ghee and numerous ways you get things in. Those are not as available here, but otherwise you could do those things. The doses for kids are proportional to their weight. So the official human is 150 pounds. That's the official human. And so all doses are based on 150-pound people. So if your child weighs 50 pounds, they'd take a third of the adult dose. But you want to be a little careful to work into that a little bit slower, because you just want to make sure they're comfortable with using it. And then certain things are going to be suitable for children and certain things not. So that takes, again, a little bit more study.
There seems to be a lot more anxiety with young kids nowadays. What are you recommending for that? Teenagers and youth.
Yeah. I feel like Jimmy Kimmel. For anxiety, well, let me just think through this a little bit for kids. You know, it's lifestyle all the way around, you know. You have to look into which particular kids are anxious, why they're anxious, what's happening at home, what's happening at school, what's happening with the vata stuff we have happening, in the world, and deal with those things just in terms of helping kids relax a little bit. Chamomile is a very, very mild herb that you could use for kids. You could start with that. Some of these questions that are going to require a little bit more detail, why don't you just email me and I'll shoot you out some info.
I have a question regarding the use of mushrooms and other spices and herbs in the treatment of dementias. I've had success with the use of extracts of mushrooms and cinnamon over the last 10 or so years with several patients. And Western medicine, essentially for Alzheimer's, aka dementia, offers zero, except some kind of a placebo at an exorbitant price, repeat office visits, and everybody does the same neurological test over and over again, which is not very valuable as far as the patient is concerned and the family.
I don't think anybody heard your question because I don't think the mic was on.
About
anyway.
the use of mushrooms,
right. Gotcha.
And other therapies in the use for dementias.
I'm not going to talk about mushrooms.
I'll talk about dementia. You want to talk about dementia?
Okay. We just add addendum to your question. The mantra that we did with the sniffing today, there's other ways you could use that mantra that actually does both prevent, and there is indication in research that as reverse cognitive decline. It's a particular meditation that's called Kirtan Kriya, which I believe Satbir Singh will review a bit tomorrow when he does his research. There's also researchers at UCLA who've done a body of work on this particular method of using that breath, that mantra, with fingertips. So you can use yogic methods in addition to nutritional supplements to help the brain function properly, both to prevent and reverse the indicators of cognitive decline.
I was hoping nobody would ask about mushrooms because they're the third rail of discussion in Ayurveda. Are there anti-mushroom proponents here? A couple, yeah. In one stream of thought in Ayurveda, mushrooms are not recommended, but mushrooms do have a lot of science behind them in terms of those sorts of things, and there are some. A lot of details to get into the specifics about which one you could use, but there are several that have shown some benefit, and they can be used whole in food, some of them, and others are available in extracts. So sure, there is something that can be done. I'll just echo Shanti's comment about dementia. We're making tremendous strides, and I have several colleagues in the dementia area that are holistic practitioners of some sort, experts in that area, and every one of them is saying that we're right on the precipice of being able to bust it, because from the medical side, there are a whole bunch of new breakthroughs. From the holistic side, there are a whole bunch of new breakthroughs, and we're just sort of waiting for the studies to culminate. But when we actually see it clinically, we can see that many, many things can work very well. I'm not quite demented yet, and I'm not planning on becoming demented, but I'm not quite of the age where people typically, we typically see dementia. So I haven't seen a lot of dementia in my practice because my clients have been my age, adventurous hippies, growing old together. So, I don't have a lot of experience with that, but what I do have has been very, very positive, and so I can also just validate that we're making tremendous progress, and it looks like there's some really nice things to come. Mushrooms are not my specialty, so to the extent that I know about it, seems like there's a lot of promise there. Where is the audience provocateur?
Parkinson's disease. And then we all need to take a little bit of a walk. So we'll hear a little bit about Parkinson's, and then we'll take a break.
Another really interesting area that we're making a lot of progress with, I'll give you just one suggestion from Ayurveda. That's a bean called mucuna, M-U-C-U-N-A, or the Sanskrit name is kapikachu. And that by itself is probably not a cure for Parkinson's, but that's kind of a core treatment that is used, and then we use some of these other kinds of things. The Jatamansi that I mentioned, the Geta Kola that I mentioned, both are used. I just attended a conference recently with a colleague of mine who presented a case of a person that had full-blown disabling Parkinson's, and a year later he was symptom-free and off all his medication. And we've, I think, all seen similar examples or something pretty close to that. I mean, we've taken a big bite out of it, and we're really making a lot of progress. It's a really exciting time. A lot of these things that we just thought were, impossible. We now have just been grinding away on it for decades, and now we put together all the little pieces, and we can do very, 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 very well with it. Shanti was saying that when someone gets a diagnosis like this, we're not the first people they come to, So it's been a while for it to kind of go through this process to finally get to us, to let us figure these things out. So typically people in my field have not seen a lot of Parkinson's or a lot of dementia, or for that matter, even a lot of heart failure or something like that, because those occur in older people. And we're just now to the age where the baby boomers are starting to retire and seek out people, like us.
And this is from yogic and meditation. I'm going to change that, use it better. From a yogic and meditation perspective, from the movement of prana perspective, the meditation Kirtan Kriya, which I believe Satbir will discuss with you tomorrow, has been indicated for help people on a clinical level. It hasn't yet been researched, but on a clinical level, we do see improvement with people, and certainly a stopping of progression. And the other method we use clinically is called 1 minute breath, where you take 20 seconds to inhale, retain the breath for 20 seconds to exhale. It takes a while to master this. So you relax while you're not doing it the way it's indicated. So you build your capacity to it. but we found that people who are able to slowly build their capacity, something about the increased oxygenation of the blood and the way that the brain begins to self-regulate through the shift of that breath rhythm, it does show improvement.
Okay, we're going to take a break now, and there's some refreshments around the back and the restrooms right behind us as well. Thank you.